Hey there, I'm Daniel, and I'm just going to be doing a short video on the respiratory system. I'll be covering the organisation, ventilation, respiration, and inspiration, that is breathing in, and expiration, that is breathing out. So pretty much, the lungs, as you can see here, they're made up of tiny sacs called alveoli, as shown here. These allow the exchange of oxygen for carbon dioxide from the air to the bloodstream. This pretty much allows for oxygenated blood to travel through the bloodstream and be supplied to the muscles and organs around the body as it is needed. The body cavity which houses the lungs and the heart also is known as the thoracic cavity, and there's a large muscular sheet separating it from the abdomen, known as the diaphragm. So as you can see here, here is your diaphragm, here's your thoracic cavity, and here's your abdominal cavity. So the lungs are surrounded by this fluid-filled sac, which is known as the pleura. And this attaches to both the wall of the thoracic cavity, known as the parietal pleura, and the wall of the lungs, known as the visceral pleura. So the easiest way to imagine this is to imagine the lungs as the hand here, and the pleura as this fluid-filled balloon. So as you push the hand into the balloon, it surrounds it and you can imagine it attaching to both sides, causing it to be around. So inside of the sac, there's a fluid known as the intrapleural fluid, and pretty much this sac, the pleura, allows for easy gliding movements during breathing, and also has other roles, as you'll learn later on. So this is just an overview of ventilation. So ventilation is occurring up here. That would be the exchange of air between the outside environment and the alveoli, which make up the lungs, through bulk flow. So as you can see here, here's a general representation of an alveoli, and here's atmosphere. So the air from the atmosphere, rather. It comes in, and you pretty much have your oxygen coming in with your carbon dioxide coming out. So then on to number 2, that being gas exchange. This is the exchange of oxygen for carbon dioxide through the process of diffusion. So here you have oxygen being exchanged for carbon dioxide. So pretty much what happens is your deoxygenated blood, which is returning up through the lungs, is then oxygenated as your carbon dioxide is taken out, as you can see here, and oxygen comes in from the alveoli. From here you have gas transport. So pretty much your newly oxygenated blood travels through your pulmonary circulation to the left side of the heart, where it's then pumped through the systemic circulation out to the tissues. So once you get to the tissues, you have gas exchange occurring once again. So here you have oxygen being transferred to the tissues while carbon dioxide is taken up into the blood. So here once again you have a change of oxygenated blood, which is coming here, but for what is now deoxygenated blood. As you can see, the oxygen is leaving the bloodstream. So here your cells then use this oxygen from the blood to undergo cellular respiration and make energy. While this blood is then travels back around to the right side of the heart, where it's pumped back around to the pulmonary circulation as deoxygenated blood, which can then be oxygenated again, and the process starts once again. So ventilation, in general, is the exchange of air between the atmosphere and the alveoli by bulk flow. It is affected by pressure differences between the atmosphere, outside, so the air outside, and the inside of the lungs, the alveoli. So we can refer to these as alveolar pressure, or P-alv, and atmospheric pressure, or P-atm. So when the pressure of your alveoli is less than the pressure of the atmosphere, air will flow into the lungs until there is no longer a pressure difference. So similarly, when your alveolar pressure is greater than your atmospheric pressure, air will move out of the lungs until there is no longer a difference between the pressure. So what causes these changes in pressure? The changes in alveolar pressure are made by changes in the dimensions of the lungs. So, as you'll see here, a change in volume causes a change in pressure. So if you have a closed space here with a gas in it, as you can see there, 5 atoms of whatever gas it is in there. So if you increase the volume of the container, so imagine the container as the lungs, if the size of the lungs increases, it's going to cause a decrease in pressure inside, because there's more space for these atoms to be around. They collide with each other less, and it just causes less pressure in there. So similarly, if you decrease the volume of the container, or decrease the volume of the lungs, so shrink them down, it causes a pressure increase inside. So this is pretty much the basics of the breathing mechanism. So in breathing in, the volume in the chest increases, which means the pressure decreases, and air is then able to flow into the lungs. So likewise, if the volume of the lung decreases, the pressure inside increases, and air flows out of the lungs. So what causes these changes in lung dimensions? So a good way to think about lungs is to imagine them as balloons. So if you think about a balloon, you're able to fill it up with air, but naturally it wants to recoil back down to a smaller size. So if you pull on an empty balloon, it will resist it, and it will try and shrink back down to its normal size. So lung size is pretty much controlled by being what's known as a passive elastic structure. The volume of the lungs actually depends on the pressure difference between the outside and inside, and also their resistance to stretching. So as you can see here, this lung elastic recoil, as it's called, that is the force pulling the lung back in, while there's also forces, the pressure differences here, which are pulling the lungs out. So contraction of your respiratory muscles, such as the diaphragm and the muscles in the ribs, enlarges the size of the thoracic cavity. Remember, that's the cavity which houses the lungs. So this causes a pull on the lungs and a change in the pressure differences. So here I'll just talk about what's known as transpulmonary pressure, which you can see right here. This is your transpulmonary pressure. So transpulmonary pressure is defined here as the difference between alveolar pressure and intrapleural pressure. So if you want to look at it as an equation, it's the difference, it's P alv minus PIP, where PIP is intrapleural pressure, which is the pressure inside of this sac which surrounds the lungs and attaches to your chest wall and to your lungs. So in here, you can see there's a pressure there and there's a pressure here. The difference between these two pressures is known as a transpulmonary pressure, and here it's demonstrated to be 4. So if you want to put that into equation, you can say let P, your pressure of the alveolar, be 0, and your pressure of the intrapleura, or the pleura, be -7. So if you have 0 minus -7, that's going to give you a value of +7 millimeters of mercury, which is a standard measure of pressure. So that inside the pleura, it's always negative. So if it becomes more negative, it's actually going to cause an increase in transpulmonary pressure. If you imagine if that value changed to -8, that would cause this transpulmonary pressure to be +8. So when you have your stable state, that is, you're not breathing in or breathing out, it's just at a standstill. So in this state, the pressure inside of the lungs is the same as the pressure outside. So your P alv, the alveolar pressure, is equal to 0, and there's no movement of air. The elastic property of the lungs is trying to shrink them, while the transpulmonary pressure is here. So the elastic recoil is trying to shrink the lungs, while your transpulmonary pressure is working to try and expand the lungs. So in this situation, the forces cancel each other out, and they're equal. So the size of the lungs is held in place. So as I said before, inside of the pleura, there's this negative pressure. Here it's about -4 millimeters of mercury. It's known as the PIP. And what actually happens is there's a vacuum effect. If you imagine there's negative pressure in here, so it has this vacuum effect, and it's trying to pull the lungs out, expand them. So this negative pressure, it's caused by the fact that the lungs and the chest wall are actually trying to move away from each other. So this expands the size of the space inside, and it causes the pressure decrease because the volume here is increasing. If you imagine these two are trying to pull away from each other, so it causes an increase in the volume and a negative pressure, which subsequently tries to pull the lungs out more. So here, I'm just going to go through the process of breathing in. I've been through the process where we're in a stable state, where you're neither breathing in nor breathing out. So now I'll just go through the process of inspiration. So here you have your diaphragm, remember the big muscle at the bottom, which separates the abdominal cavity from the thoracic cavity, and your inspiratory intercostals. These are the muscles which surround the ribs. So when these contract, naturally, it allows the thoracic cavity to expand in size. You can see here, an expansion of the thorax. So when this happens, so if you imagine this expands, so this pulls out. So that's going to cause your intrapleural pressure, PIP, to become more subatmospheric. So it becomes lower. So as we said in the equation before, if this becomes lower, it's going to cause an increase in your transpulmonary pressure because of the equation. So your transpulmonary pressure is increased, and therefore the forces acting to expand the lungs exceed the pressures resisting, so the lungs expand. But when you expand the lungs, what actually happens is, like I said before, there's an increase in the size of the volume, so the pressure inside the lungs, your P alv, actually becomes lower, becomes subatmospheric, and since it's lower than the pressure outside, air is going to flow into the alveoli, so your air is going to come into the lungs. That's basically the process of how you breathe in. So your muscles contract, your thorax expands, the intrapleural pressure becomes more subatmospheric because there's pulling on the wall here, which increases the size of there. So that then causes an increase in your transpulmonary pressure. The lungs expand because that's the force acting to pull out. And then, because the lungs expand, the size of the container increases, your alveolar pressure becomes lower, and then it's lower than the air outside, so air flows into the lungs. And that's how you breathe in. So now I'm just going to go through expiration, which is breathing out. So when you finish breathing in, or inspiring, your respiratory muscles, your diaphragm, your inspiratory intercostals, like I said before, they stop contracting. So when this happens, your thoracic cavity begins to shrink back to its normal size. So your chest wall, as it says here, recoils inward. So once the chest wall is no longer pulling on the pleural cavity to expand it, the pleura is also going to shrink back to its normal size. This makes the intrapleural pressure return back to its stable state value, and because of that, your transpulmonary pressure is also going to go back towards its stable state, or pre-inspiration value. So, just like before, when your transpulmonary pressure changes, it's going to cause your lungs to recoil back towards their normal size. And when this happens, your air inside the alveoli becomes compressed, because remember, the size of the container, the size of the lungs is shrinking, and so your P alveolar, your alveolar pressure, becomes greater than the pressure outside of the lungs, and your air is going to flow out of the lungs and that's pretty much how you breathe out. So just to go over it one more time, these muscles stop contracting, the chest wall then recoils inwards, causing a drop in intrapleural pressure, which then causes a change in transpulmonary pressure. Because of this, your lungs return back to their normal size, causing inside the lungs to have a greater pressure, which then means that the air is going to flow out of the lungs until there is no pressure difference. Thank you for listening.